Hello and welcome to Healthy Knees for You. My name is Robin Robertson with Healthy Knees Coach, and I am here today with Dr. Michael Thorpe. I'm so happy that we get to spend time together, and we're talking about knee surgeries and pain relief today. That might be top of mind for you. Now, Dr. Thorpe and I have known each other for quite a while. In my 12 surgeries that I had on my knees, I know, 12. He did 10 of them, which helped me keep going for all the years until I ultimately had the final two, which were knee replacements. But before we get going talking about knee surgeries and pain relief, I want Dr. Thorpe just to share a little bit about yourself in case our viewers don't know you. Tell us a little bit about who you are and what you do.
Okay. Well, I grew up in Iowa, and I went to college on a basketball scholarship, played for Division I Drake University for 4 years, and while there I also threw the discus, which I liked to do in high school, and did that for a year, and then also played on the volleyball team, the men's volleyball team, for a couple of years.
Love it.
So, three-sport athlete, and then after finishing college I went to University of Iowa for medical school, 4 years there, and then came out, escaped Iowa, and came to Washington, went to the University of Washington for my 5 years of orthopedic surgery training, and then came straight from there up here to Bellingham and practiced almost 33 years, retired January 1st of 2021, and loving retirement. I'm now just a father of 5 and grandfather to 10, and like a school bus driver, driving them to school.
I know, we were just talking about his normal route during the day of picking up these grandkids there and those ones over there. Sounds wonderful,
It's
really.
great. Good times.
Yeah, he had a fantastic career, and I feel so fortunate to have met him when I was looking at a very invasive surgery called an osteotomy because I was too young to have a knee replacement. Now, we covered that in one of the previous videos, and today we're really talking about knee surgeries in general and the kinds of injections that are out there for pain relief, talking about how they work and do they work. I think that's one of the bigger questions. So let's just start with, in your 33-year career, what were the 3 most frequent kinds of knee surgeries that you did, and why did you do them?
Okay. Most common would be just a knee arthroscopy for a meniscus tear. So either doing an arthroscopic meniscectomy, which means trimming the tear out, or a meniscal repair, which wasn't as common. Usually meniscal repairs would be along with an ACL reconstruction. It's a bigger injury, younger people, and so you would occasionally have to repair the meniscus. So
can you sew them together?
Yeah.
I mean, how do you repair them?
Yes, you would sew them together. If it is in the outer third of the meniscus, so the meniscus is kind of a C-shaped structure, and the blood supply comes in from the outside, the joint capsule, and if the tear is out here in the junction of the middle third with the outer third, or anywhere out there in the what we call the red zone, the vascular zone, you can sew those together.
Okay.
We have neat little devices that you can shoot in, like little darts, to pin them together.
Really?
And you can do it. You can do it all from inside. So if I'm scoping the knee and that's the meniscus, and I can shoot through the meniscus here. Say the tear is running like so.
I see. Yeah.
I could shoot through here, deploy a device out here, kind of like a molly bolt through the wall. You stick it out, it deploys. You pull back, and it's attached to a suture. And then you come over and you shoot another one in, deploys, and then you pull back, and it's like a slip knot, and you pull and you slip knot, and it pulls it together.
And so grab the knee model,
Yeah.
and you can see that nice rim on the meniscus here.
Yeah. So the blood supply comes in this from the outside in only 1/3 of the way. So tears in the outer third, like so, are the ones that you could repair. If it's tears in this way, radial tears or parrot beak tears or horizontal cleavage tears where it's torn into a top half and a bottom half, then you would trim that out. So that's called a meniscectomy. So those are all done arthroscopically. So an arthroscopic meniscectomy or repair would be probably the most common knee surgery I did. And then I did a few thousand knee replacements. I didn't keep track of how many ACL reconstructions, but that would be a third operation that I did a lot of, where somebody would tear their ACL. That's the big ligament right here in the front of the knee, usually a sports injury, and then after they tear that, their knee would give out like so, and we would go in and put tissue back in place of that ligament to secure their knee.
Where do you get the tissue for an ACL repair?
Several options. The two main divisions are your own tissue or allograft, which means cadaver tendon. And so the choices from you could be your patellar tendon, which is, again, this tendon right here. So we would make a slit and take the inner third of it or so, about a centimeter wide, with a little bone from the patella, a little bone from the tibia, drill a hole and push the graft up in and secure the one bone plug into a tunnel that we would make in the femur, pull down on it, secure it here with a screw. So you're basically putting a strip of this where the old torn ACL was.
Oh, yeah, I see. Yeah.
So that's one option. Another option is using the quadriceps tendon. So taking a little bone from the patella and a strip of this tendon, there wouldn't be bone on the other end, but you'd put that bone up in the tunnel into the femur, pull down on this part, pull down and secure it down here with a screw or suture tied around a screw or something like that.
That's amazing, really. The technology is just amazing.
It's pretty fun.
Yeah.
And then a third kind would be to use the hamstrings. One hamstring tendon called the semitendinosus, and you can use it alone and double it into four folds, or use it and the grassless, which is a tendon that you use to pull your knees together. And that just generically is called the hamstring repair. Or reconstruction, I should say. So, and then, or if you use the cadaver, you would probably use the patellar tendon from a cadaver.
With an ACL repair, can somebody function without, if they've torn their ACL, can they function without doing the repair?
Yes. Most of the time, that would be a person that's fairly inactive. If you're just a cribbage player and a bridge player, you don't need your ACL. So I would always talk to patients, hey, are you going to be playing basketball? Are you going to play soccer, football, ski, those kind of things? Are you going to be climbing and jumping from one boulder to the other? If you're doing that kind of stuff, you probably need your ACL fixed, very, very likely. There's a few exceptions to that rule. I mean, one of my patients was the all-time leading scorer at Western Washington University on the men's basketball team. And he sprained his knee when he was a sophomore. This is before I came to town. And never had any surgery. And then he and I were playing City League basketball together. And I said, why are you wearing that brace? He goes, I sprained my knee. And I said, can I examine your knee? So I laid him down on the basketball court. No ACL at all.
Oh.
He didn't know it. He played his sophomore, junior, and senior years with an ACL deficient knee and was the all-time leading scorer at that time, and he didn't know.
That's crazy. So did he ultimately have it repaired? No. Or is it too late then?
It was too late. He was too arthritic.
Yeah.
Yeah.
Okay.
So, ACL should be fixed if the person's younger and athletic. Kind of at 40-ish, some people are 40 and act 60, and some are 40 and act 20. So age isn't exactly the cutoff,
right?
But it's awfully rare to need an ACL reconstruction if you're over 60. 60 or up, it's pretty rare.
Okay.
Most people aren't doing the things that you need an ACL for.
Right.
I
fine.
I got in trouble with my wife when she tore it at 55 or 56 skiing, and I said, honey, don't fix it. She goes, why? And I go, well, you're 56.
There's trouble.
I'm still recovering from those broken ribs. But her knee was already a bit arthritic also.
Yeah.
So again, she shouldn't be doing the things that you need your ACL for if you have an arthritic knee. So
right.
You got to sit down with your surgeon and talk about it. But it's pretty knee jerk. You should if you're in your teens and 20s for sure. Maybe even early 30s. You got a lot of life ahead of you.
Right. And,
every ACL tear eventually results in an arthritic knee. So one reason.
Bad news.
Yeah, and that's even if you get it fixed, but it does slow it down because if your knee isn't shifting and sliding around abnormally, you're not having this kind of action going on, you're not going to wear this cartilage out as
Right.
fast. And the same thing goes with meniscal repairs. If you can get your meniscus repaired instead of cut out, you're going to be preserving your joint for a longer period of time.
So interesting about that, with the condition I was born with, a discoid meniscus, the technology of the time was to remove
Take it
the
out.
entire meniscus.
Yeah.
And I had that done when I was 13 years old, because that's what was done then. That was before arthroscopy was invented. It was an open knee surgery. And my doctor said, exercise is tolerated by pain. And not knowing what that meant as a kid, because my knees had always hurt, I became a runner, which is probably one of the worst things I could have done for a knee with no meniscus. And I was an avid downhill skier, competitive runner, loved the mogul skiing. Both of those things added up to severe arthritis by the time I was 24 years old. So
yeah, if we had been able to do arthroscopy on your knee, which I've done several of those,
Yes.
the lateral meniscus is discoid, which means instead of embryologically it starts as a D and then slowly hollows out, becomes a C shape. Well, hers still had all this meniscus still there. So if we had trimmed it and made a C out of that D, you probably wouldn't have
different. I might not be here talking to you about knees.
Yeah, that's right.
So
All in
for
God's
better
plan.
for worse, I figured I was given a lousy pair of knees for a reason, and that's to talk about knees and help people with knees. So who knows?
And you
Sometimes
do.
you
And you
take you take those things and go with them, whichever way you can.